and I would need an over-the-counter drug to help me deal with this pain?
I would advise people to seek medical treatment. The reason being, you want a proper diagnosis to begin with. You don't want to just assume that any pain is simply osteoarthritis. You may be right. But then at the same time, because we don't just simply want to take medication endlessly, we want to see if you need other treatments, other treatment modalities like physiotherapy. If it's so advanced and someone needs joint replacement, no amount of painkillers will
save that.
And also to get supplements. Those you can also get over the counter. So definitely advise someone to first at least get a diagnosis from a doctor in the hospital. Yeah.
Would that affect fertility in any case? That, constant taking of arthritis, medication to try and manage and maybe just ease with pain. Would it affect fertility, especially on either gender?
No, it may not affect fertility, but these common drugs that we're using, the anti-inflammatory medication, is not advisable to use during pregnancy. It has effects on, especially in the first trimester, it has effects on the fetus, meaning it may result in heart disease in the
How about somebody who's been taking this medication for a very long time before even trying to get pregnant? Would it be something that would affect them if they want to try for a child?
No. I mean, I've not heard of that. What happens is that we advise that you don't take the medication while pregnant because of the effects it has on the fetus. You asked something else that...
all right, maybe it's slipped your mind. But let's talk about the cost of treatment. You said maybe getting X-ray could be a little bit cheaper because to try and see the type of arthritis that one is presenting themselves with. But is this something that any Kenyan could afford? Say somebody from Wajir, those far-flung areas. Is treatment affordable?
When painkillers are affordable. I'll say the cartilage supplements that I mentioned earlier are not very affordable. They may not be easily accessible for everyone. Physiotherapy is also not very easily accessible to everyone. It's quite costly because the thing is, even with physiotherapy, you probably need a number of sessions. So that is not something that every Kenyan can afford. And of course, when you talk about replacement, that's the most expensive of all of the treatments. And I would suppose that's why many people will just fall back on just taking the painkillers. Yeah.
So what happens if somebody cannot afford treatment for arthritis? Do they just go for this over-the-counter drugs for the rest of their lives?
Yeah, most of the time, as we said, osteoarthritis has no cure. It's a progressive disease. So what we advise patients is just take the painkillers whenever necessary, and not that you're taking them as one would, for example, in a case like diabetes, where you just have to take the medication whether you feel any symptom or not. So for osteoarthritis, what we advise is try to take the medication only when necessary. And the thing I wanted to mention is why it's necessary to see a doctor is because some of those anti-inflammatory drugs also have effects on the stomach. So you find people develop ulcers, stomach ulcers, because of repeatedly taking that medication. So what you want to do is at least have the advice of a doctor that take this medication only when necessary, take it for a limited amount of time, try to increase physical activity. So even if you may not afford the physiotherapy, the physical activity will help to reduce the symptoms of arthritis.
All right, we have a few feedback here. Hi, my name is Kelvin. I'm watching from Rongai. I'm only 32, but my knees crack every time I stand up. Is this an early sign of arthritis?
The cracking. Well, that's one of the things that people mention. So if it's associated with stiffness, meaning that you feel like you can't fully bend or stretch the joint, the knees, then you need a checkup. And associated with pain, then you need to be checked and see what that could be about. So one last thing I could mention is we find a lot of young people with joint pains, and in our setting it's actually just simply, you find that simply it's just low vitamin D in the body, and once it's corrected, then you're able to have full joint function, and the pain reduces. Yeah.
So how do we correct that lack of vitamin D? Yeah.
So vitamin D, the form that is necessary for the joints to function or for the bones to have strength, is we get it from being outdoors in the sun. So the sun rays convert the vitamin D.
Even for a 30-year-old, a grown adult?
You find that, at least in my experience, what I found is the younger people, treatment with vitamin D helps them to reduce the joint aches. Yeah.
All right. Dr. Njeri, this is Mama Jackie. I'm watching from Mombasa. Can arthritis be triggered by cold weather? My joints are always worse during the rainy season.
Yes, you find that not necessarily triggered, but it does aggravate the symptoms of arthritis. So even for people with rheumatoid arthritis, the joint pain is worse when it's cold. You find that even some people who have the metal plates will say that when it's cold, they even feel it more. So yes, cold does not cause it, but it just makes it worse. Yeah.
So what is the solution for these people who are in the say colder areas?
I would say just keeping warm will help to reduce that. Yeah.
All right.
Obviously treating the arthritis itself will reduce that. Yeah.
We have more here. My name is Wairimu. I'm watching. This is Makongeni. My mom has arthritis and has been taking painkillers daily for over